Welcome back to Dental Vibes. I'm Gabby.
I'm Carla, and across the United States, dental offices are getting ready to open back up, which is kind of exciting, but also a lot of us are still a little bit apprehensive, having some questions. So we're going to talk about that in this video.
Yeah, so there's a lot of things that are going to change. We came up with a protocol for our soft opening, so we want to share it with you guys. But if you have any additional tips for us, please make sure to let us know in a comment.
And as usual, don't forget to like and subscribe.
And hit the notification button so you don't miss any of our videos.
So there's still a little bit of questions out there that haven't been, answered.
Or lots of questions.
Yeah, and a lot of concerns. And, before we get into it, I want to say I'm a little bit upset because it's always been like dental versus medical, right? And during this time, it's like
we're not healthcare workers.
Yeah, like your oral health is not part of your overall health.
Yeah.
And so I feel like the dental was like, hey, go and fend for yourself. You find your own PPEs, and we're just gonna source hospitals and all that, which was important. But I just feel like we were like thrown out to the curb.
And on that note, I would have to say, I was listening to the radio the other day, and they were giving a shout out. They're like, thanks to our health heroes, all the nurses out there, the doctors, the grocery store workers, the drivers. And I was waiting to hear, the dental people out there, but no. And, I'm to the point is like, I don't need anybody to come and thank me, oh my God, you're a hero. It's not even that, but I mean, people need to understand that we are at high risk and that we are putting ourselves on the line to do our job.
Right, that's a good one. I haven't realized it, but I'm like, yeah, because you were working during this whole time, and at the beginning you didn't have the proper PPEs. So there you go.
Just rolling the dice.
So also we got like a message from one of our friends, and they're like, my office hasn't reached out to me. I have questions. I don't even know when they're gonna open. And I mean, what do you answer to that? It's just like,
pick up your phone and call. I mean, I couldn't even imagine just sitting at home, not knowing what's gonna happen, when I'm gonna go back to work. I mean, guys, communication is key. You need to call your office manager, call your doctor, and figure out what's going on, when you're opening. Any questions that you might have, they need to answer that, because there's a lot of he said, she said things, and I cannot stand that. Other people are saying, well, this is what we're doing, this is what we should do, and sometimes it's not the right facts. So if you have concerns, call your doctor, call your office manager, get your questions answered, but then also
do your own research.
Make sure it's reliable. Your source is reliable, but do your own research, because a lot of people are just freaking out. Like, well, this person said this, and oh my God, and it's like, maybe it's not even all that.
There was also like what we've talked about that you mentioned, that is like, okay, some things are just recommendations, right? So they because a lot of things are not available to us yet to purchase, it doesn't mean that you necessarily need it. So with that in mind, if you don't feel personally like safe, if you've already discussed with your office what's going to be their new protocols, and you're not happy with what they have, you can also make that choice, right?
No one is forcing anybody to do anything. No. So I honestly have a problem with people saying, well, my boss is forcing me to go into work. Like, you can say, hey, I'm not happy with this, and I'm gonna quit. I mean, really.
Or take a break.
Or take a break. Or, I mean,
I'm not feeling dentistry right now.
Exactly. And, you can go explore a different field for the time being, and then once this, is over, then you might come back. But you do need to come to terms with your personal feelings and choices, and I feel like a lot of people need to stop pointing fingers.
Yeah.
Saying, oh, it's their fault. It's, you know, it's just like, listen, this is what it is. Once you gather all the information and you know what your future is going to somewhat look like, and you're not happy with that, then you make the choice if you want to continue or if you want to leave.
Yeah. And like in a month from now, our next video will be in, you know, totally different. You know, that it's like nothing happened because so much changes on a daily basis that we just have to play by ear. Not everybody has all the answers, not even the government. Not even the government. They're trying to figure out as we go. Yeah. So I like that you said, you know, we need to really pay attention to the guidelines because some things are not required, they're recommended. And you know, in a perfect world, we would have all the PPEs that we can dispose after every patient. We would have all the N95 masks. Yeah. But in reality, that's not what we're facing. We are working with limited supplies. And some of those things, they are recommended for most effectiveness. Right. But it doesn't mean that, you know, we cannot work without that. Yeah. So again, that is a personal choice. If you don't have certain things that you feel that you need to have, that's okay to feel that way, but don't think like, okay, this is a requirement and I'm not going to work without this. Right. So let's get into what the new protocols we're seeing are being established as far as PPEs for the, you know, everybody in the dental field. All right, let's start with the first one, which is a big one. Let's talk about masks. And the ADA already has in their website their interim guidelines for what masks and face shields we should be using. It's no surprise that the N95s are not, you know, available. And by the way, if you have a dealer for N95 masks, link them on the comments, please. Yeah. What are we doing after the N95? I mean, what have you been able to find? So far, we were able to find the KN95s, which is one level down from the N95. Okay. And I feel like it's been working fine so far. We would wear that and then wear a regular mask on top to keep that one clean because I was only able to find 50 and that needs to last for a little while. So we are reusing the KN95 for a few days and keeping it clean with using a mask on top and then the face shield. I did see that the like how it ties on your head is different. It hooks on your ears like a regular mask, but if it fits tighter, it must hurt. It does something. It does hurt, especially if you work in a long shift. Yeah, it's very painful. So I saw somebody posted on this tip, which you get a regular headband and then you put 2 buttons on like where your ear would be, and then you just actually hook it to the buttons instead of your ear, and I will tell you, it's been night and day for me. Okay. Yeah. Yeah, that's good. That's good. So instead of your ears, it's holding on to something. Yeah, and again, guys, remember, sometimes you got to work with what you have. So the N95s are available, great. If they're not, step down, N95s. If that's not available, you can still use a level 3 mask. And what Dr. Angulo was telling me about this 3D frame. So you pretty much do a 3D scan of your face, send it to a lab, and they'll print out this 3D frame that fits around your face perfectly. Like custom. So you would be wearing the level 3 mask, and then you put that frame on top of it so that it kind of seals on your face. So again, it would be perfect. Everybody would have the N95s, but if you don't, there are other options that you could try that's available out there. Absolutely. Now, the second one is disposable surgical gowns, which, I mean, it was already a thing. Like some offices were using it, but there's limited availability right now. Again, if you have a dealer, let us know. So probably a lot of people are like, no, well, if we're gonna use those, then we have to use them new one after every patient. But if it's limited availability, I think that you just have to work with what you get. I mean, definitely like every day. Yeah, so what we have in our protocol is we're going to have a surgical gown every single day. At the end of your shift, you're going to dispose that. So with that being said, you need
need to be mindful of everything that you touch. So you have a surgical gown that you've been working all day, it is filthy. You cannot go around the counters, lean on it. You cannot go up in the front and sit on a chair, right? You just have to kind of be a robot and just try not to touch things. But in reality, again, if that's what you have to work with, that's what you gotta do.
And again, I feel like this I'm pretty sure this is just gonna be throughout this time. You know, as things get better, we'll find things much easier. Now, another thing that it's always been around is that you're supposed to wear your hair up, and I feel like I can't work like this. You know, I put my hair up in a bun, and you know, if I want to look cute for a consultation, maybe have like a string of hair, but then I have a clip ready to pull it back up. And I think now that should be, if you were, you know, slacking a little bit, you should definitely have it up and cover your hair with either the
disposable hair caps, or I mean, some people are just making it at home and then they just wash that, which is fine.
I think so, because we can't. I don't wash my hair every day.
Exactly, especially for the ladies that don't wash their hair. You don't want to go
all this beautiful hair.
I don't do this every day to my hair.
So, okay, let's talk about the next one, the face shields. Those gigantic face shields that I'm seeing going around. I mean, for me, it's new because I do wear my glasses. You know, I do have the goggles, but this is like full on.
So again, a lot of the face shields are not available. I mean, Patterson, Henry Schein, you name it, I tried. They're all on back order. So there are some other companies that are providing. There are some companies that are doing 3D printing. So and then if you're wearing loops, not so much for assistants, but like hygienists and dentists, then it's even more annoying and difficult. But there are options out there in different styles that you can try, but I think face shields is a must right now, because one, if you are reusing your masks, then the face shield is another layer of protection. And you know, we're dealing with a lot of things right in front of our faces, so having that protection is important.
Yeah, I agree. Won't hurt. Now, how are we cleaning up the rooms? Because
there's been a lot of questions about that.
It's like, do we just like bleach the heck out of our rooms, or are the cavi wipes, or just Cavicide? They're not ruling out Cavicide. They're saying that's okay.
Yeah, so I mean, there's so many people that are overthinking this. And I'm just gonna be honest, you're overthinking it, okay? If alcohol, hand sanitizer, and soap and Lysol will kill the coronavirus, I'm pretty sure Cavicide, something that's
doing good.
Something that's a lot stronger and that kills most virus out there, are still okay to use. So let's just do what we can to clean up. But I would say that's what we're doing in our office. We're cleaning as usual. We use Cavicide. And then in some areas where like, oh, I haven't touched that, so I'm not going to clean. Well, aerosols are going around, so you might want to make sure you cover those areas. And what we're doing is just having the Cavicide in bottles.
Okay.
After your room is clean, you just kind of spray the Cavicide everywhere. And if you miss any corner, then that will take care of it. And then, of course, the Lysol in the air.
And with that, if you have a lot of decorations or teeth models on your counters, I think that should be put away for now. Keep your counters as emptied as possible, so it's easier to clean, and that way you can make sure you're getting all those corners and all the little areas that need to be clean, and you're not mortified.
Out of sight, out of mind.
True. So now, if after that, the barriers is the same. I mean, we are putting barriers up everywhere. We keep that up. Even like the keyboard, right? The mouse.
I mean, honestly, anywhere that you feel is necessary. I mean, some people are going overboard with the barriers, but hey, I always say, do you?
I agree. So now let's talk a little bit about the new protocols that are going to be for the patient.
As far as patients' protocols, a lot has changed.
But not so much like what you started doing during seeing emergency patients during this time.
I mean,
it's kind of just keeping it.
We already started implementing this with, you know, our emergency patients.
Yeah.
But
so you're still doing the screening.
We're still doing the screening. So we do pre-screening on the phone. Patient comes in. Well, doesn't even come into the building. Outside, they're going to take their temperature. Once they come in, they're going to be screened again. There's going to be a hand sanitizer little station right inside the door. And then once they're in the room, before they sit down, we have them rinse with it's a mixture of Listerine and peroxide.
Okay.
And they sit down. We do what we need to do. We've been using the dry shield.
Yeah, which is great. Even before these times, I love the dry shield and the 𝐒𝐿𝐈𝐃. If you have any of those, use them now more than ever.
Yeah, it's been very helpful. And then after we're done, we have made this little cute sign to put on top of the sink. And we guide the patient to the sink and have them wash their hands before they walk up front to check out.
That's a good idea. Now, are we still like bringing their family members, like if they want their
Absolutely not. And I think that everybody
is gonna be happy.
Everybody's gonna be happy with this rule. I'm sorry, ma'am, you cannot bring your family in.
Yeah.
So yes, one patient at a time inside the room. So that's been very nice.
Yeah, and since a lot of offices are still working through their like soft opening, the staggering of appointments, right? You don't want like everybody wants their waiting area or reception area filled with patients. Yeah. Waiting anxiously for the dental treatment. But not right now, right? It's gonna slow down.
Of course. I mean, patients are going to be waiting in their cars until it's time for us to bring them back. Schedule is completely different. We're going to have half the staff working one shift, the other half working the other shift. Patients are going to have longer appointments, so we don't have to rush and you know clean properly. We are going to skip a room, so you know we're going to be working every other room to give space. So there's a lot of changes. We're not just, hey, we got the green light, we're gonna open like nothing happened. No, there's a lot of changes that's gonna be happening.
And I guess at least for a while until we see how
it goes,
how things develop. You know. So this is the protocols that we're gonna start implementing in our office. Of course, this is information that we've gathered so far from all over, and it's what best suits us. But if you have more suggestions, we are welcome them. So leave us a comment so that we know we have no problem adding things to our list. It's important that we share information now more than ever. Yeah, and now the most important is for us to remain calm. Yes. Let's not give ourselves a heart attack, guys. Make sure you're getting your facts straight. Communication is key. Communicate with your team to make sure that we're doing everything we can to be safe, but also we're not neglecting our patients. We're getting back to what we love to do, which is dentistry. And make sure you like this video, subscribe to our channel for more dental vibes, hit the notification button, and we'll see you next time. Keep smiling.